Welcome everyone, welcome delegates, welcome presenters, panel members and special guests. Today is the second day of the Western Victoria Primary Health Network's Primary Care Conference 2023. What a great day was yesterday. I hope you all enjoyed it as much as I did. We had close to 100 people registered for Geelong, as well over 200 joining us remotely. And to those who are joining us remotely, I get it, hopefully you're at home with your pyjamas and Ugg boots on because it's a bit chilly here. Welcome to you as well. For those of you that don't know me, my name's Rowena Clift. I'm the CEO of Western Victoria Primary Health Network. I would like to acknowledge the traditional owners and custodians of the unceded lands and waterways of Western Victoria. The Wadawurrung, Gulidjan, Garabanud, Kirrawurrung, Pikwarong, Gunditjmara, Jabwurrung, Watchabulik, Jajawurrung, Jadwajali, Wagaya, Jarawa and Jakabuk peoples. We recognise the diversity, resilience and the ongoing place that First Nations peoples hold in our communities. We all pay respects to their elders, both past, present and commit together to working in the spirit of mutual understanding, respect and reconciliation. And we support self-determination for First Nations peoples and organisations. I want to acknowledge that many of you are on those many lands and other lands of the First Nations people, and that yesterday we did start 2023 National Reconciliation Week. We also know that current discussions on the voice are and will impact our First Nations peoples. We recognise the need for listening and learning and respectful dialogue. I also want to acknowledge the lived experience participation in the design of services that we commission, and for those who were here yesterday, the amazing input of Kim. People with lived experience provide us with valuable insights and can guide us with prevention, planning, treatment and education. We also recognise their strength and courage and unique perspectives as a vital contribution to our work, to learn, to grow and to achieve much better outcomes. And I just also want to note, on a personal note, the families in Hamilton, which is my hometown, who are really badly affected this morning through the death of 4 children, 4 year 9s, in a car accident with one currently fighting for life in the Alfred. So my heart's back there a little bit as well. Primary health care, with general practice as its core, is an integral and robust and sustainable health service for all. The recent announcement of more funding, we'll say that in inverted commas, for primary health services across the country by the federal government is starting to take some steps towards those critical services for all in the community. We know we need a strong and sustainable primary care sector, and we need the right care for people regardless of where they live. The role of the 31 primary health networks across Australia is to leverage our knowledge and understanding of our local health and healthcare needs. We do 3 key things. We support general practice, we commission and purchase locally needed services, and we integrate local services and systems. So we've been around 8 years, can you believe it? And we've now matured to the point where we are no longer satisfied with just delivering on the government programs that we're asked to undertake. We want to now exceed the deliverables of programs by integrating programs to better meet community needs. We approach our work with a singularity of purpose across the organisation. We focus on health equity for priority populations. We partner to support health systems and health outcome improvements. We use our depth of insight in our communities to tailor solutions to that local environment. And we strengthen our data, our research, our evaluation and our insights. We see Western Victoria Primary Health Network as a connector in the health system, a funder, a capacity builder, a researcher, a partner and importantly, an advocate. We also see the role of the health consumer evolving as a very active part of the health system through self-care. And we're partnering in our region with health and social service providers, all levels of government, non-government organisations and universities to try and build a better healthcare system for some of these beautiful people in front of me right here. We recognise the capabilities and challenges and the work that together we need to do to build capacity. We support the mental health reform agenda in Victoria. It's complicated when you've got two levels of government thinking they can fix something. And we really want to ensure what we do in aged care, in mental health and disability is helping our communities. You would have seen our 3-year strategic plan that Lynn spoke to yesterday. It does give you an overview of the health of our communities or poor health of our communities and our plans to improve on health outcomes. There are more copies available if you would like one. Another vital piece of work that we continue to do is to support general practice and all primary healthcare professionals with opportunities and resources to enhance their knowledge base and overall professional development. The Medical Board of Australia introduced the new annual continuing professional development requirements for general practitioners effective from 1 Jan 2023. I'm probably preaching to the converted here, you all know it back to front. These changes aim to enhance practitioner performance and improve patient care by mandating that GPs complete 50 hours of CPD each year across 3 different activity types. So what are we doing? We're continuing to develop activities and learning packages to assist GPs to meet their CPD needs in this triennium. There will be a renewed focus on peer group learning with activities such as Project Echo, a continuation of our comprehensive webinar offerings, our skills-based training, and of course this wonderful event, our Primary Care Conference. This year's conference theme, Toddler to Teen Health, an Investment in the Future, was based on feedback from the healthcare community in Western Victoria. Many people, including children, are still finding it difficult to readjust post the global pandemic. The disruptions caused by the pandemic have impacted children's health and well-being in a multitude of ways, from interrupting their schooling, their social lives, enforcing periods of isolation, exacerbating existing health conditions, and creating emotional and financial stresses that have affected many families in unpredictable ways. At the same time, we know paediatricians and tertiary care specialists are struggling to meet this demand for their services. So this conference aims to bolster paediatric skills and knowledge in the primary healthcare workforce. I also want to mention the work that we are doing in partnership with our 8 Aboriginal controlled health services across Western Victoria. Our work this year has seen us develop a set of First Nations health principles that will inform the work we do. Our key elements are self-determination, data sovereignty, and listening, and being respectful in what we do with our First Nations communities around practice, and we're also holding a regional health forum. And I want to pay tribute to my colleagues in the 8 ACHOs who continue to work with us, tell me when I've got it wrong, but also support us on this journey. Before I conclude, I really do want to thank the staff of Western Victoria Primary Health Network who have worked tirelessly on this event. And if any of them are in the room, can you just stand up for a minute? All of you, come on, I know you're very shy people. They're all down the back, of course. Can we just say thank you for such a fantastic event? So well done.